Now let's have a look on the mapping of a relationship set with the cardinality M to N. M to N, and here especially with attributes in the relationship set. So we have added attributes here in the relationship set. Again, a scenario from our hospital. A doctor is somehow related to a patient or to many patients. The doctor has attributes, doctor number, doctor family name. The patient has a patient number and the patient family name as the attribute. And the doctor now, one arbitrary doctor from the set of doctors, is connected by the treatment to many patients. So the doctor actually is not concentrated on one patient only. This would not make sense in a hospital. The doctor works for many patients, for treating many patients. And if we look onto the patient, then an arbitrary patient from the set of patients is connected by the treatment, or is treated by maybe many doctors. Because maybe one doctor might not be enough. There's a doctor for the general treatment, and then maybe there are special treatments, and we need many doctors in the hospital to treat one patient. And then there's this treatment. The doctor somehow performs the treatment onto the patient, and this treatment may have the treatment diagnosis, a treatment date, and maybe some other attributes. So we have this here as a relationship set, might be a possible model for our case, and in this relationship set we have attributes. If we maybe have a simpler model, then we might neglect these attributes, and then we might neglect them as the columns as well, but let's assume that we have here these attributes. Now again, like in the case of 1 to N relationship with attributes, we first transfer the entity set doctor to our doctor table and the patient entity set to our patient table without adding any additional attributes other than the given attributes from the patient, only patient number and patient family name, and only doctor number and doctor family name in the table of the doctors. And as the connection, as the mapping from the relationship set onto the tables, onto the relational database model, we create this third table, this treatment table, which contains a doctor number, a patient number, both foreign keys first. The doctor number is a primary key in the doctor table, and here it is a foreign key in the treatment table first, and the patient number is a foreign key from the patient table, where the patient number is the primary key. So, and then we add the treatment date also as a part of a compound key in our treatment table. Why do we do that? Now let's have a look at the reality. It might be the case that a doctor with a certain doctor number treats a patient with a certain patient number. And then the treatment might be done, the patient is okay. But later on it might be the case that the patient comes again to the same doctor. And then again the doctor number appears here in the treatment table and the patient number. So the same doctor and patient number combination. And if we would have only these two attributes, these two columns as the primary key, we would not be able to identify the treatment as unique. So the later treatment would appear as this with the same ID. So we have to add the treatment date as a third part of the compound key in our treatment table. And this treatment date now, this distinguishes our doctor-patient number combination regarding the date when the treatment happened. So treatment date as the third part in our compound primary key. And again, we can write it with the textual notation, doctor table, patient table, and in the treatment table we have the doctor number, patient number, and treatment date as the compound primary keys.